now.
Okay. Well, good afternoon, everyone. This is Ken Crandall. Just want to welcome you all to the Seneca Healthcare District Board meeting on today's date, April 29th, 2021. Boy, I'm dating myself. I'm going to call roll and then we'll jump into the Pledge of Allegiance. So I want to see board members. Dr. Walls, are you with us?
Yes.
And you're in the meeting room, right?
Yes.
Okay. Jerry Nielsen, are you with us?
I am.
Hi, Jerry. Okay, and Rich Rydell,
Here.
and you're in the meeting room, correct?
Yes.
Okay, thank you so much. And Kristen Montgomery? Kristen, are you there?
Yes,
Okay.
here.
Thank you. And I am here as well, so we have full board attendance. That said, it's time to say the Pledge of Allegiance, so please join me in saying the Pledge of Allegiance. Ready to begin? Here we go. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. That takes us to item number 3 on our agenda, which is the public comment period. I can't quite tell who all we have in the boardroom. Is the only other person in the boardroom, is that you, Sean?
Just no, there's we've got Jim Koeman, we've got Karen, and TK. So there's several people in the and Steve Boleen.
Thank you for that. All right, so is there public comment, comments people would like to make?
For those that are joining us remotely, *6 will unmute your line.
I'm sorry, TK, I missed that.
I was just reminding the online guests that *6 on their phone will unmute their line if they want to address the board at this time.
Thank you.
We have no one present and no one raising their hand.
Okay, I will move on to item number 5 on the agenda, which is the approval of the minutes from the March 25th meeting, our last meeting. If you've had a chance to look at that and there's any things you'd like to highlight or corrections to be made, please speak up now. If not, we will entertain a motion to approve the minutes.
So moved.
That was you, Rich?
Yes. Second.
And Dr. Walls, second. Okay. Jerry, your vote?
Aye.
Okay, Kristen?
Aye.
Dr. Walls? And Rich?
Aye.
And I'll vote aye. Okay. Item number 6 is informational. It is the med staff report. And if you had a chance to look at this, this is a delineation of privileges. The only item on this form signed by Chief of Staff, Credential Chair, and ready for a President of the Seneca Board to sign. And so I advised Joanne I was going to try to come by tomorrow afternoon and do some signing. So that should take care of that. Any comments, questions on item number 6?
My only comment, Ken, is that Dr. Cooper could not be here today, so he asked me to be available if anybody had any questions, but there's no report, so there shouldn't be any questions.
Okay, thank you, Dr. Walls. So we're moving on to item number 7, moving quickly here. Excuse me, these are policies and procedures. We have policies and procedures that need approval, and we have some that need to be rescinded. And I guess the rescind deals only with procedures as I read this. At any rate, item number 7 on the agenda, the first ones 1 through 9 as identified on the agenda are all in need of approval. Are there questions for, I guess it would be Dr. Walls, on any of these policies?
The only one I have, and I think it's 1 through 7. I don't have it up on my screen right now. It's the transcutaneous cardiac pacing. That one, there's just a couple of misspellings on the first page. Under procedure,
Okay,
it's policy number ED 035001.
correct. Can, do you have it in front of you? Can you,
Yes, number 1, I think, I'm assuming emergent should be emergency, possibly not. Bradydysarrhythmias is spelled wrong. There should be a T in there from my understanding.
okay,
If not, then correct me. Other than that, all the rest of them everything else looked fine for me.
other comments from board members? What I'd suggest, is-
I have just a comment for Karen. After the medical staff meeting, I brought up the issue about the insulin. Were there changes made
Yes.
to that? Can you tell me where that's at in here?
Let's see. Changed all that verbiage.
I was looking for it, and I need a roadmap of all these policies and procedures.
I think it had to go back to policy committee, Dr. Wall, like back to medical staff.
Well, as long as the changes were made, that's all I care about.
Yes, I made the changes, but I believe Chelsea told me it had to go back through.
Okay, that's fine. I'll just.
so I'm confused here. That was, which one was that we were referring to?
Well, that's my question. I don't remember which one it is now, but it was
It was
pertaining
amended
to,
to med administration. It's not in this.
It's not in it.
it's not in here?
No, it's not in here yet. It'll probably be in the next.
Oh, okay.
Okay.
No wonder I couldn't find it.
Then I would entertain a motion to accept with spelling corrections as needed, mentioned by Kristen, to accept policies 1 through 9 as identified as policies needing approval on our agenda.
So move,
And that was
Dr. Walls.
Dr. Walls, thank you. Second,
Second,
Rich. Okay. Jerry, how do you
Aye.
vote?
Aye.
Okay. And Kristen
Aye.
and Rich
aye.
and Dr. Walls.
Aye.
I will vote aye as well. The second group of, they're identified here as procedures, where we send the following procedures. So we have 1 through 8 as identified on the agenda. And I'm wondering if there's any questions or comments about rescinding these procedures.
This is Jerry. I make a motion to rescind 1 through 8 as listed on the agenda.
Okay, thank you. I can have a second.
I'll second it. Dr. Walls.
Thank you. Rich, your vote.
Aye.
Kristen,
Aye.
Dr. Walls,
Aye.
Larry,
Aye.
and I'll vote aye. Okay, that takes us to item number 8 on our agenda rather quickly, which I'm assuming brings up Steve. Good afternoon, Steve.
Hello. Okay, we're looking at tab D.
Correct.
Okay, so tab D is the financial report for the month of March 2021, 9th month of our fiscal year. We held a treasurers meeting this past Monday with Chris Rydell and Jerry Nielsen and Sean McKenzie, and went over these financial statements, so I will be somewhat brief as I am. So in the month of March, we had a net income of $4,554, which doesn't sound like much, but we had budgeted for a loss of just over $328,000. It was a positive variance of just under $333,000. there's a couple components of this positive variance. First piece of it is that our total patient revenue was below the amount we had budgeted by 198,000. The source of the negative variance on revenue was all from the inpatient side, both in each area, acute swing bed and long-term care were all under budget or negative budget. The gross patient revenue, inpatient revenue was negative 216,000. Our outpatient revenue was positive 18,000, so right at budget. The next big piece was that our deductions to revenue, our net patient revenue as a percent of gross, however you want to look at it, was 88.2% versus a budget of 56.9. Again, the higher number better. That means we're converting more of our patient revenue into funds, go to the bank. And the big thing that happened in contractual adjustments, positive variance, was we received a lump sum adjustment from Medicare to adjust our rates for the current fiscal year, July of 2020 to through February of 2021, to reflect the recently settled Medicare cost report. So we received a one-time payment of 500,000, the entirety of which is reflected in our contractual adjustments. Expenses, there were a couple of areas that were slightly above budget, hours and wages and supplies. The big variance was purchase service. Per our contract with HRG, our outsourced company, they receive a commission when not only do we have a lump sum adjustment such as we did in the month, but we also receive the cost report settlement amount, about $1.4 million. And so their commission on that was obviously well above budget. And that was really all that was going on in the month of March from income statement operation standpoint. Any questions or comments, concerns?
Board members, any comments, questions, concerns, as Steve said?
No.
No?
Not
Okay.
any? Well,
So-
thank you for that, Steve. I guess we need to have a motion here to accept the financial report.
So moved is Jerry.
Okay,
I'll
Second.
second.
second, Kristen. Okay, Dr. Walls,
Aye.
okay, Rich,
Aye.
and Kristen,
Aye.
and Jerry,
Aye.
and I will vote aye as well. So thank you, Steve. And I'm not sure, Sean, I'm guessing you're going to speak to us on item number 9.
Actually, we're going to, if Linda McCurdy is on, I believe Linda's going to address number 9.
Okay. Linda, are you there?
Yes, sir. Good afternoon, everybody.
Good afternoon, Linda. Thank you.
So to speak to this agenda item, Seneca Healthcare District, in conjunction with Aspen Street Architect, as the designer of the roof project, procured an OSHPD permit to move forward with replacement of the metal roof on the Seneca Hospital building, so which we've been looking forward to doing for some time. So approximately the 1st of March, Seneca Hospital put out a request for proposals to roofing companies through different publications and different venues. Just to let you know, they went out fairly far and wide. We did local online newspapers in all of the local counties. We did newspaper in Butte County. We did it in the Sacramento area. We also put them out in builders exchanges in Shasta County, Butte County, Yuba County, Sacramento County, and Washoe County in Nevada. So we wanted to make sure everyone was aware that we had a project to offer so that we might be able to get appropriate bids, which is difficult to do right now. So it is unfortunate, but out of the 6 bidders that came to the mandatory pre-bid walkthrough on March 31st, we were only able to obtain 3 persons that were interested in submitting bids. So you have the bids, I believe, in your packet. We received one from ARC Construction and Roofing for the total of $251,000. We received one from D&D Roofing Incorporation for the total of $529,800. And we received a bid from Baird Roofing for $727,250. Those bids appear to be a bit far-flung between the three of the bids, but with the assistance of Aspen Street, we dug into the ARC construction and roofing bid, and were able to determine that it was a responsible bid and a qualified bid for the district. ARC has also worked with Aspen Street Architects as a subcontractor in the construction of the Trinity Hospital project, and we were told that there were no surprises. The work was quality. There were not excess change orders, and that they had no problems working with these individuals again. So at this time, I'd like to request that the Board of Directors proceed with a notice to award that particular contract to ARC Construction and Roofing.
And where are they located, Linda?
These people are located in Palisadro.
Let's see that. Okay. Well, board members, do you have questions about the bid?
My only it's not a question, it's just an observation. It's a huge fluctuation in these prices.
And no kidding. It's kind of concerning.
Don't. I know it's a little concerning. I believe that's Dr. Walls I'm speaking to. So, Dr. Walls, we went back and we did a little bit of research. And in 2018, we asked for a bid from a reputable company for a standing seam metal roof for the hospital. That bid came in somewhere in the neighborhood of approximately $178,000. And they did not bid in prevailing wage, which is unfortunately required on all public works projects at this time. So in looking at what we have, the fact that prices have gone up a bit, especially for construction materials over the past couple of years, we believe that the ARC Design bid is an appropriate, responsible bid for this particular project.
Well, I'm not questioning that. I'm just wondering if these outlandish bids were because they didn't want the project.
I'm not sure what prompted them to give us such outlandish bids, because they had to put bid bonds or cashier's checks on this for 10% of the bid amount. So it cost them a bit of money. I really don't know what their thought process is throwing this out there.
Interesting.
All right.
Other questions, other board members?
It sounds like Linda did a great job researching this, and I would like to make a motion to move forward with awarding the bid to ARC Design for $251,000.
Thank you, Jay. Can we have a second for that?
Second.
Okay, Rich Rydell, just a second. Dr. Walls, how do you vote?
Aye.
Okay. And Kristen, how do you vote?
Aye.
And Rich,
Aye.
Jay,
Aye.
and I will vote aye as well. Thank you for that, Linda. That was a good, thorough, and brief synopsis of the whole thing. Are you going to speak to us about the painting bid also, Linda?
Oh, yes, sir. I've been having plenty of fun the past month or so. So the first week of March, Seneca Healthcare District put out another request for proposal for exterior painting for the majority of the buildings on the hospital campus. We had a very good response. I actually had 7 bids come in. 5 of those bids were all within $20,000 of each other, where the other 2 were almost double the amount or more of the low bidder. I did vet the first 5 bids. I did not vet the 2 bids that were $143,000 and $144,000 because they were so high above what everyone else had bid. So what we've determined after vetting all of the bids and going through the references is the apparent responsible low bidder is HB Restoration Incorporation. It's been noted that HB has worked for many school districts and many county facilities, as well as healthcare facilities over the past few years in the local region, including doing $160,000 worth of work for Plumas County over the 2018-2019 year. I was able to conduct reference checks, especially with Plumas County. They said the people did their work timely within budget. They cleaned up well after themselves, and they even did work that wasn't required out of their own pocket if they thought it would be aesthetically pleasing. So I would like to request from the board that we accept the bid submitted by HB Restoration Incorporation for the total of $58,900.
Okay. Board members, questions about the bid?
Where are they located?
HB Restoration is located, sorry, Doc, I got my papers a bit shuffled here. They're down in the valley in Cottonwood.
Okay,
I'm
And
double checking. Wait a minute. Okay, I got it now. Actually, they're in Rio Linda. I take that back. Out of the 7, they're in Rio Linda, California.
by Sacramento. All right, so Linda, here's the burning question. What color are we talking about?
You know that as far as roof colors and as far as paint colors, Sean has determined that there will be a few folks that are very good with colors that are not Sean and possibly myself to be selecting those colors for both the roof of the hospital and the colors that'll be used on the buildings for painting.
Yeah, Ken, we're gonna stay with the blue palettes, in alignment with our new logo and branding. But that palette is wide, it's a wide berth, and I think Linda summarized it best. I am not the person to be picking colors. So we've got some good eyes amongst us.
Well, we appreciate your candor there, Sean. Okay, Linda, thanks for the work on that. Can we have a motion to accept the bid for HB Restoration?
Well, I'll make a motion.
Dr. Walls?
I'll second. This is Jerry.
Second. Rich, your vote?
Aye.
Okay, and Kristen?
Aye.
Okay, and Jerry?
Aye.
Dr. Walls? Dr. Walls, your vote?
Aye.
Thank you. And I will vote aye, so that motion carries. All right. Thank
I'd like
you,
to say thank you very much, and I will make sure that notice to award letters are issued to both of the responsible bidders tomorrow. Thank you.
Linda, I'm sorry, one quick question. I probably should have asked this earlier. What's the projected start date for the projects?
Projected start date for the painting is 30 days. Because it's going to take us a week or so to get contracts moving. As far as the roofing contract, we have a prospective start date of 45 days from the signing of the contract. We have to give the contractor ample time to be able to order and get supplies here.
Sure. Okay, thank you. Just curious. Thanks. Nice presentation.
Thank you.
Thank you, Linda.
Okay, so we are now on item number 11, which is California Association of Rural Healthcare Clinics, the membership renewal. I believe we discussed this last time and there was, it had lapsed if I'm not mistaken. So this is to renew our membership and to discuss upcoming trainings. So I am not familiar with what upcoming trainings are on the horizon. So can someone speak to that as well? Does anyone in admin know of upcoming trainings?
Number 11.
Oh.
Discuss the upcoming trainings.
I'm sorry, I'm not hearing you very well.
This was brought forward in the last meeting when we were talking about associations, and it was recommended that the rural healthcare clinics, CAR, membership was put forward, that we would go forward with this and then discuss upcoming trainings. I don't have a training schedule
Okay.
from this association, but this was brought up as one that we should belong to in the last board meeting, as I recall.
Yeah,
But I don't have information about the trainings that they are going to be conducting.
right.
Probably.
Historically, I think they've afforded us ethic trainings, Brown Act trainings.
Ethics, right?
Yeah. So, I mean, and I participated and I found them to be of use and value. So I'm hoping we can move forward.
I don't think our ethics and Brown Act training came from this group.
I thought they did. What group was that, Rich? I went to.
I thought it was through the county that we got our.
I thought it was the district, thought it was the special district council I just
Yes.
received something from Mimi Garner.
Yes, that's where we got our
Oh.
training.
I think that was offered there also, but I remember being a new board member and going.
Dave, you
What was the meeting we went to?
That's
down-
what we went.
Yeah, but there was also one that I went to in Sacramento. What was that?
might
That
have been
was the ACHD. That was the ACHD one, I think,
Yeah.
Dr. Walls.
Okay.
Do we know how much the membership is for the CARHC?
This is Anne. We are already a current member of the CARHC.
Okay, I think I was confusing both of those two organizations, so can somebody tell me the distinction between these two organizations?
Sure. The Association for Critical Access Hospitals is for that, and this is for clinics. I can't tell you specifically what their agenda items are, or their advocacy, or what they do. This would be the first time I'm exposed to them.
Okay,
So I know they differentiate regarding clinic or hospital, but I don't know what their agendas are differentiated. Steve, do you have any idea on this? Any input?
The Rural Health Clinic Association advocates, typically they focus on freestanding clinics, but we benefit from some of their advocacy. We're also a member of the National Association of Rural Health Clinics.
Right.
And our relationship with these groups has absolutely proven beneficial. So I would be supportive of continued membership in these groups if our membership is coming out.
What is our cost for membership?
And do you know what we pay for both NARC and then these guys?
If I remember correctly, the national, I believe, is 600 and the California is around 400. And there are sometimes a discount if we pay the fee together. I can confirm those numbers if you give me a few minutes.
Okay, well, that's.
Looks like their conference this year is June the 21st.
Okay. Well, it sounds like,
The ACHD one is current, is that right?
that's what I
Yes.
understood. Yes, okay.
Okay.
And so the only one in question here is the California Association of Rural Healthcare Clinics, that membership. And if I heard that correctly, Steve was suggesting that there's some benefit to us to joining this. The price to me seems nominal, so I'm wondering if we have a.
Well, let me ask Ken, if it's nominal, why do we even have to deal with it?
I think it was just brought up as an agenda item on top of
Yeah.
some of the other committee that we were asked to join, the other group. You know, just from my perspective, there are so many changes that are happening in the rural healthcare area and critical access area that I'm going to just, for the board's pleasure, I'd say if it's a nominal fee, then let's stay with them.
Absolutely.
And let's not let our.
I don't think it
advocacy
needs
drop.
to be a board item.
Yeah,
Oh, I see what
Their
you're saying.
decision.
I gotcha.
okay, so
So what's your pleasure, Sean? Would you like a vote in support from the board, or do you feel comfortable?
I don't think I'm going to go with Rich. I don't believe it needs board support. I think it's something that as an organization, it's well within the spending limit. We're just going to go ahead and push forward on our memberships.
Perfect. Thank you so much. We'll do that then. All right. Any other questions, comments related to that? We'll move on to item number 12. And this is a discussion of whether we're going to continue online or to hold meetings in person starting in May. So Sean, I saw this and I wanted to make sure I understood the differences between the tiers and what the recommendations are for the tiers and where we're at in our tier. I think we're still in yellow. Am I correct?
We are in orange, I believe, still. But I can tell you that there's a lot going on as it relates to who can join, who can be maskless based upon vaccination status. and such, I'm going to recommend to the board that we right now we have a hybrid. So the people that are in this room are vaccinated. Almost everybody, and those that aren't are, 6 to 10 feet away from everybody with masks and a bodysuit on. I'm going to recommend to the board that our May meeting resembles the hybrid, and then based upon the June 15th governor's perspective on opening the state, that we start welcoming back in the community. We'll put some criteria around that, but once again, things are changing so quickly as it relates to how we can act once we're vaccinated and such. I think we need to play this out for another couple of months.
Yeah, I appreciate the caution there. So the recommendation before us is that we continue with the hybrid meeting until we've heard the governor's report on, you said June 15th?
That's when the state is supposed to open up, but details around specifics, how the state is opening up and what's allowed, I think is following CDC guidelines, and CDC guidelines have changed weekly. So I think we just need to continue to monitor.
Okay. So I'm not sure we even need a vote on this. I'm just going to continue with the hybrid model.
Agreed.
Until an update in June, and we'll update in June.
Yeah, okay, in June. Okay, perfect, thank you. That takes care of the action items on our agenda. So we can now move into the information components, and that brings up the HRG report from Steve.
Yep. Okay, as with the financial report, this is the report for the month of March, or as of March 31st. We're in tab G, we is in Litterer this month. The ARDs are down to 61.1, which is trending in the desired proper direction. We're still above our target, and it really surrounds our continued struggles with getting Medi-Cal to pay. Much improvement in Medicare and the other third party. And, we continue to hold actually 2 calls a week with HRG now, one with our larger revenue cycle committee, and then a smaller group with myself, revenue cycle coordinator Sarah Lynn, and our finance manager Kelly Pettigrew to talk about very specific issues. And so I guess for now, we're pleased with the progress, but still dissatisfied with where we're at.
All right. Questions, comments? Steve, is the recommendation I'm hearing just to stay the course for now?
As far as HRG?
Yeah.
Yeah, when their contract comes, we talked about this in the treasurer's meeting a little bit. If they continue the progress and don't backslide, then I see no reason. We are going to make some changes to the contract. We made an attempt to put some penalties in for them, and the way that it's worked out, I don't think it had quite the impact that we're looking for. I have some ideas about how to remedy that and really hold them to the performance standard, and then have the penalties closely aligned with the performance standard. We need to do a little bit ourselves internally. Very important that we get our bills out in a timely manner. One of the key elements of the contract is that we get our that we have an unbilled of 5 days or less for the month of March. It was 5.3, so we're just barely above the target, and we've made some good progress. December it peaked at 10 and has worked its way down very close to the target. So it's something we're working very hard on and looking at, again, internally what we can do to make sure that that happens.
Okay.
So for now, that's stay the course, right?
Okay, yeah. Others? All right. Steve, thank you for that. I'll move on our agenda, item number 12, Strategic Planning Committee update. And Sean, I'm seeing that this is you.
Yep, I will report on this. So there's been a lot of activity with the planning, the strategic planning for the new critical access facility. We are still in our land purchasing due diligence phase for trying to chase entitlements and such. The purchase is near complete with Collins. In fact, it is complete. We just need to move through escrow. We have 60 days for due diligence. Due diligence requires a property survey or an NSD topo, what they call a topo survey. It requires a geotech survey and then escrow closing. And after escrow closing, we will have the property and we'll be moving into another phase. There are some things that we need to do in our due diligence. And if you will look on the second and third page, there's a list of the due diligence items from Monmouth Construction. These are being managed. These individual actions are being managed by Building RX, which is our program manager that we have brought on to manage us all the way through first patient. We'll be doing our due diligence. We have selected the consultants, NST and Geotech BSK, for both the geotech and the property survey, the topo survey. So those will start moving forward. We will be moving into, following that due diligence phase and the escrow closing, we're going to be moving into the schematic design phase. Schematic design phase is going to be more particular surrounding the plant itself, more specifics related to square footage. It's also going to be reflective in our entitlements as we start to move through some of our work as it relates to infrastructure, easements and such. We were on a call yesterday with the county, and I have to say that I'm getting mixed messages from the county, publicly to the board, where we have walked through the zoning of that property with members of the county. And then yesterday I heard the exact opposite of what we were told initially. So we need to get some clarity around our zoning requirements. It is zoned now where, as of yesterday, where we have to apply for different zoning before we can move into the planning phase or looking for entitlements and plot information. So I'm going to be working with very carefully with Sherry Thrall, our supervisor, to understand what is real here. It actually put us back from a scheduling timeline. If you look on about the fourth page, there's an overall project map or project Gantt chart showing that what we're working toward in 2025, which is opening. As of yesterday, unless we get clarification, it looks like there's a 6 months to a 1 year delay in getting all the rezoning done. So we're gonna look into what exactly we need to do and how we can shrink that timeline. It was a little bit of a shock yesterday to notice that, because it will change the project timeline overall. Even though we are doing multiple different swim lanes, what I call swim lanes, simultaneously, unless we can get entitlements to that space, zoning, things taken care of, it's really hard to move forward on much of anything else. Schematic design we can move forward on, but at the end, our schematic design has to be completed for the zoning requirement and for the plot. So a little confused right now, but we have Building RX and Monmouth Construction and Aspen working toward understanding the path a little bit better with the county. And I will be incorporating Sherry Thrall into that discussion more and more.
Sean,
Try to figure out.
just a question about that, because I don't fully understand zoning changes, and what accounts for the length of time it takes to get that completed?
Okay. What we were told, I mean, it's just, I asked how long it would take on the phone call yesterday. I heard it's going to be the application process, which we can do right away, will take 6 months, and then it's got to go to the Board of Supervisors for approval, and then it's got to go back. So that was a year. They just, did the math. 6 months and 6 months is a year. I can get the application put in tomorrow if they would like it. And so we're looking for a streamlined process here, Rich.
Yeah. It just seems like a pretty lengthy process, and I'd sure like to see it expedited if possible.
Did you get, excuse me, Ken, did you get this from the planning director?
Yeah.
Who's?
Yeah.
Okay.
And the thing is, we got from other members of the planning division within Plymouth County, we were told the exact opposite, that our zoning, the current zoning, does allow for a hospital and such. And we were told yesterday that the current zoning does not allow for it, for this kind of a use. Even a special use permit cannot be granted with the current zoning. This is what we were told yesterday, but that's exactly the opposite of what we were told a month ago. So
I think, I used to be the planning commissioner for this area, and anticipating that a hospital would build. I think what you were told previously is more accurate. But let me get involved in helping you as well.
Love for you to get involved in it because, yeah, there's two different messages coming out. So we need to figure out the one that's, quite frankly, we're not building a bowling alley. We're building a hospital. So I'm hoping that the county, is able to, to expedite some of these activities so that we can move down our plans of 2025 first patient. So that's what we need. That's the update on that, the Gantt chart. Any questions about that particular thing? I'd like to move, if not, over to existing facilities upgrades.
Board members, anything else?
Have you had any negative feedback from residents around here, Wildwood, or anything like that?
No, I don't think the residents just yet are familiar with what we've got planned. There is going to be impact studies. I mean, it was brought up yesterday in the county meeting that they want to do a complete intersection, a traffic study for Highway 36 in Reynolds. They want 2 ingress and 2 egress, or 2 ingress and 1 egress. And we talked about Brentwood being available as an egress point, Reynolds being available. They discussed traffic patterns, and Linda can add to this traffic pattern around what comes down Reynolds, but that's already our ambulance. That's our ambulance ingress location anyway already. So there's a lot of discussion around traffic studies and noise studies and light studies and EIR. The EIR was the other thing that came up, that we can't file for an exemption to the EIR based upon surrounding areas. Frankly, what this did, the bothersome piece to me was that it not only added time, but it added, I heard the jingle of money. There was a lot of money. You got to pay for this, you got to pay for that, which, I expect we're gonna have to pay for some of these things, but a traffic study, for instance, what's that going to run? I don't know. But we do need to do our due diligence on this and understand the path forward, because we've got a Gantt chart sitting here that we're going to map to this project chart timeline. And any delays, change orders, or things like that just, bumps that Gantt chart forward. And but once again, the board needs to be aware that, we're going to be chasing this down so that we can follow as close to the project timeline as possible.
Okay. All right, Sean, you said you wanted to talk about the upgrades for the existing building?
Just one other thing. In the May meeting, right now we've got a few numbers for our due diligence related to our land purchase, but in the May meeting, we'll have a much more comprehensive overall budgetary schedule to present to the board. I just want you to know that's in process to understand the costs associated with year over year of this project. And we're trying to dial that down. I just want to let you know the board will see that in May. Okay.
Okay, thank you.
Existing facilities upgrades. So Project Botox is, as you might have heard from Linda, is well underway when it comes to roofing and painting. There's many other things that are going on as it relates to Project Botox. We've discussed them in the past. What I would like to draw your attention to is the spreadsheet presented to the board at the very last part of tab H. This is Project Botox capital requests, and this incorporates everything that we're doing to the facility and physically, whether it's the roofing, the large projects, the roofing, the painting, but these are all the fine things, everything from replacing furniture that's been cracked and broken for a very long time, upgrades to the Lake Almanor Clinic waiting area, internal painting, things that we need to do to bring this plant up to speed and, quite frankly, make it look good. We've got at least 5 years here. So what we'd like to do as part of our complete transformation as an organization, Project Botox, is we had, Steve, help me out here, we had approved in the 1920, was it 1.4 by the board? I can't remember, or something like that, 138.
1.7.
Hey, there it is. I was way off. 1.7. Of which there is $985,000 left over. We have built, capital expenses, and Steve has a complete spreadsheet for that. Of that 985 that was approved by the board back then, I would like approval. This is actually going to be, we're not seeking approval. This is information only at this point. We are going to be seeking a total of $700,000 in funds for Project Botox, and I will be asking for permission or seeking board approval for each pieces of that $700,000 as they come available to us in the course of the next couple of months, and seeking board approval for each one. But I want you to be aware that it is our intention to take from that capital dollars and spend it towards Project Botox. I'd take any questions.
What is the new signage?
So the new signage is we're going to be getting new LED signage on the front of the hospital with our new logo. The signage, there's been actually a lot of inbound into my office about how the signage, the arrow that's pointed on the CT scanner with an arrow that says clinic is just kind of kludgy. And in order to make ourselves look better, we're going to improve our signage and our wayfinding through the campus as well. So that's it.
So that faded out sign in front of the hospital is clinic.
That is going, that's actually, we're getting bids on that right now. That's going, the little hand painted emergency room hospital sign on the front vestibule is going to be lit. It's going to be lit through the night so you can see it. Yeah, there's just several signage things that we need to take care of and update.
And Sean, this is Jerry. Does that include any sort of signage from Main Street or off Reynolds?
It doesn't, this does not, and that has been discussed. Thank you, Jerry, for bringing that up. That slipped my mind. The awareness, our community awareness, or the awareness about having a hospital here related to people who visit us or drive through town is pretty minimal. We have talked about signage. I'm sorry, we have talked about signage on the PCT, the Pacific Crest Trail, out there, just a little sign say, hey, we're in town if you have sore feet or blisters. But the one actually on the street, we have not discussed, no, other than the Blue H.
And why have you not discussed?
Well, we have discussed it. It's just not, we haven't detailed it out, what it looks like. Does it go on a building? Is it a sandwich board? What are we going to do specifically? But the $30,000 in signage is kind of incorporates everything that we want to accomplish here.
So Sean, I had a question related to the backyard, I guess, the parking lot of the clinic. I noticed there's a boat out there and some other stuff along the fence line back there. And I wasn't sure if that was on, the clinic's property or the district's property, or if
It is not.
Okay, the fence is just set back a little bit.
Yes, it is not on our property. I actually talked to the owner. I know the owner, I talked to the owner, and the boat's going to stay there.
Okay. I was curious. There's a few other items out there. I thought I saw a wood splitter and some stuff out there, and I was just a little curious about if there's anything that can be done about that, but I guess not if it's not on district property.
Yep, not on our property.
Okay, good enough. Anything else? Board members related to this? Okay, Sean, you have some other things on your CEO report?
Yes, and I apologize to the board up front. I sent the board clerk my old report with a new date on it. And so this is not it, and I will update the packet later, but I will speak to the CEO report. Just don't reference the one that's in the packet, please. Let's start, we've already done land purchase. Let's start with physician and mid-level recruitment and retention updates. So PA, Sonia Troxel, PA has started with us. She's 3 weeks in. I'm getting great feedback from the community. I'm getting great feedback from the patients that she's taking on her practice. So I'm really excited that she's doing a great job. She covered our walk-in clinic in a period of time where Steve was taking some time and did a great job in there as well. So she's on board and doing well. We have tendered an offer out to Dr. Calvin Ruiz he came over and visited us with us for about 2-3 days and got to meet a lot of people. I have put forward an offer letter to him. I can tell you that it is between us and one other site. And we're fighting hard. This is somebody that we really would like to see come on board. Dr. Walls is shadowed Dr. Walls for about 4 hours. This is a person that we think is going to be a great fit. I do believe that we're the lead horse in this race right now. I've been speaking with him on a regular basis, answering his questions related to our professional services agreement. I'm really hoping that he makes a decision soon. He'll probably start in August if he does. And we keep pursuing that. So we have the beat on a couple of other physicians in case Dr. Ruiz chooses the other site. And we're trying to arrange some interviews with them, although they are a lot of these are residents and they're taking their boards right now. So it's a very busy time for them. So we're doing that. So recruitment's going well. Medicus has proven to be a good company. They provided us some very good candidates. So I'm pretty excited the fact that we've got some very qualified people showing up at our door. And we're moving through that. I won't go through existing facilities upgrades again. We will talk about operations. Operations continue to be refined, little by little, process by process, move by move, action by action. Our management meetings are now pretty much incorporate process improvement steps, taking on, finding something that's not working quite well and working through it without a simple answer, but actually digging deep into root causes and why things happen in the organization. This will be a forever process. This will never stop. Process improvement will be a continuous thing. We're trying to bake it into the culture of this organization. As a high reliability organization is what we're striving for. Process improvement will never stop. So operations, everything's being scrutinized. There's nothing here that gets done in this organization that isn't getting a scrutinizing eye and attention from a committee if necessary, and a lot of times a multidisciplinary committee. So that is operations in general. They will continue on. And we'll make improvement by improvement. Marketing and public relations, if you haven't noticed, Chelsea's been very busy out of the marketing public relations sector. The Chamber of Commerce has spun up the town halls starting, I think the first one is May 10th. Yes, May 10th. And then with subsequent month after month, I'm on the docket for the June town hall. And this is going to be a quid pro quo Q&A with the community. They can ask any question they want. They can talk about the past, but we're not going to spend a lot of time on the past. We're going to be moving forward, but it'll be a time it'll be my venue, if you will, to be able to share what's going on with Seneca Healthcare and let the community fire questions and just give them updates as often as I possibly can through a face-to-face versus any kind of a social or an online media.
Sean, can you just restate the dates there?
May 10th is going to be the first community or it's a chamber-sponsored community forum or community town hall. The May 10th one is not going to have us. It's actually dealing with the cold water issues, the FERC and the cold water issues with Lake Almanor. That seems to be a hot topic right now, so they're going to do that one. It looks like we'll be on for the June meeting. It's going to be the first Monday in June.
Okay, thank you.
And that'll be published. We'll publish those dates. That'll be a good opportunity.
Okay, thank you, Sean. Are there other questions from board members for Sean?
I saw something about the auxiliary was paying for the security camera project. Is that right?
The auxiliary approved 3 things through their charitable giving, the auxiliary giving. One was the security cameras. The other one was LED high intensity procedural lights in the emergency department to replace the incandescent lights that we have in there now, much brighter, cooler. And the third is it's a computer that goes on our portable X-ray machine so that they can do quality control without having to go back to ER. They can do bedside quality control over their images and get them off to what we call the PACS system of the radiologist more quickly. That was approved as well. We also, our charitable donation to our flagpole, I forgot to say that, we have purchased our 40-foot flagpole that we're putting in the front of the hospital. We are going to be doing the commemorative reveille or the ceremonial reveille to welcome it into the community on Memorial Day. And that was also purchased through a charitable donation.
Yeah, I just wanted to say thank you to the people who helped with that. That's great. And the auxiliary.
Yep. Great stuff.
Okay, last chance to ask questions here, board members of Sean. Well, Sean, thank you so much. Very informative. All right, that takes us to item number 14, departmental issues and reports. We did receive a report from on compliance from Karen Turner in Emergency Department Acute Care, and from TK and from Jim Kuiman. So does the board have questions related to any of these reports? Are there questions?
This is Jerry. I don't have any questions, but I just wanted to express my appreciation for the managers putting these together because they're very informative and it helps me at least kind of see where we're at.
Indeed, thank you. Anyone else? Well, I guess we're letting a lot of folks off the hook today with no hard questions, so we'll just move right on. Item number 15 are items to be added to next month's agenda. What do we have besides our usual stuff? Anybody want to add things to the agenda? Necessary agenda items?
Fiscal 21-22 budget,
2021 budget,
21-22, yes.
22. Okay,
We'll be seeking board approval for our, a new business associate agreement. We have had it updated. And ours was quite outdated, so that'll be on the board. We'll be seeking approval on the new BAA.
okay. So make sure those are added to the agenda. This now takes us to item 16, which is the closed session. And so TK, I would ask you to help us out so we can, and let me know when you're completed removing people from the main meeting so we can begin our discussion.
Just a moment.
So the recording has been resumed, correct?
Yes.
Okay. Okay. The closed session has been adjourned and we are resuming our open session. I want to note that there was no reportable action taken during the closed session. And that we will now move to item 18, which is our next regular meeting, which is scheduled for May 27th at 3 p.m. And as I understand it, we will continue under a hybrid meeting format until sometime in June. So thank you all for joining and we'll see you next time.
Thanks, everyone.